Magandang araw. This presentation is based on the findings of the study entitled Building on Strengths, a research on humanitarian localization and locally led response in the Philippines, and the ensuing workshops conducted with various local organizations. The objectives of the research were to define localization and locally led response from the perspective of local civil society organizations, to determine the status, the challenges, and the initiatives to promote localization and locally led response. While over 100 respondents were initially sought, there were 45 national and local organizations and 17 international NGOs and national donors who obliged to undertake the in-depth interviews and survey. Recognizing that humanitarian localization is not a well-known advocacy, especially for local organizations in the region, the workshops were meant to enhance awareness on the issues and to gather recommendations to address these. Several dimensions of localization were investigated based on the frameworks of the Network for Empowered Aid Response, or NEAR, the Grand Bargain, and the START Network. Quality and access to funding were looked into for partnerships, joint decision-making between international and local actors, long-term and formal strategic partnerships, and visibility provided for local actors by international partners were investigated. In terms of capacity, inquiries were made in capacity development, organization development, and humanitarian standards. For connectedness, the humanitarian development nexus, the coordination and collaboration amongst different stakeholders were probed. For voice, community participation, advocacy, and rights claiming were explored. By studying these dimensions, we attempted to dig deeper at the status and challenges of the localization process of international actors and how locally led humanitarian response contributed to quality humanitarian interactions, sustainable development, and disaster-resilient communities. Along the way, we also found out that localization was not necessarily unidirectional, such that local actors were influencing the quality of funding and partnerships, and that even national actors were purposively localizing further. First of all, we had to level off on basic concepts, namely humanitarian, local actors, localization, and locally led response. Amongst local actors, practically all respondents were development-oriented or had a development mandate. It was necessary to define what humanitarian is. Expectedly, the textbook answer was providing immediate aid and service to people affected by disasters to save lives and reduce suffering. But what is interesting is that there is an underlying narrative that local actors assumed that was connected with humanitarian action. Disaster response was supposed to be charity and dole out, temporary, quick and time-bound, apolitical, logistics heavy. It was supposed to have no capacity building. It's supposed to be performed by expert humanitarian professionals. These narratives limited the ways of working and the attitudes of local actors, where they either often belittled humanitarian action or themselves in performing such interventions. However, wider mainstreaming of disaster risk reduction and greater awareness of humanitarian standards have highlighted rights-based approaches and have opened opportunities for multiple and process-oriented strategies to more strategic goals of accountability, empowerment, sustainability, and resilience. As such, the underlying narratives of humanitarian action were slowly being reshaped. We also asked who local actors are, recognizing that the definitions were highly contested globally. What we heard was an equally diverse set of answers. There were the visible indicators of local actors that were often used in the global debates. The starting points were being registered nationally and being independent from international headquarters. Having local knowledge was essential but not definitive, since this apparently can be addressed by recruiting local staff. Having limited area of operations ensured better focus and mastery of the locality. Being local was also seen in terms of the nearness to the community. This was important since it recognized that some organizations were more local than others, and that an organization can be local in one community but not in another. There were also strategic indicators. Having presence in the community before, during, and after meant not only being pre-positioned, but also being there long after the response project has been closed. Being development-based connected humanitarian action to more strategic community development and resilience work. Being place-based meant being embedded as a local stakeholder. May they be a people's organization, an NGO, a local government unit, a local church, or a local private sector. But there were deeper value-based indicators. Being community-based embraced the smallness of the organization and the rootedness in the community. Being organic meant the organizations were growing with the community as it faced changing issues and evolving dreams. The principles of subsidiarity meant recognizing that members or partners closer to the community were afforded more leadership roles. All these were crucial as these local institutions were entrusted by the affected populations to represent them in various decision-making platforms. But why enable local actors to lead? For practical terms, it ensured relevant, timely, effective, efficient, and sensitive humanitarian interactions. Local actors have a mastery of the place and the people. They have access to the community and can optimize available local resources and relationships. They have demonstrated being innovative in filling the response gaps of duty bearers. Local capacity development meant enabling local institutions to respond to future disasters, to sustain disaster resilience work, and to enrich the collective capacity of local stakeholders in the community. This can lead to more collaboration and complementation of resources amongst different local stakeholders. It will also connect the humanitarian action to existing and future community development work. But most importantly, it will transform local power relationships that are often the sources of vulnerability in the community. It can enable local leadership and citizenship, encourage demand-driven responses, enhance democratic space through local advocacies and rights claiming, and promote participatory local governance. These last three intangibles are the compelling reasons to enable local actors to lead humanitarian responses. For localization and locally led response, there were varied definitions. Most respondents highlighted how localization related to leadership of local actors over humanitarian projects, and not just having local actors responding. Responding in times of need was a given. What was needed was to have access and control over humanitarian funds and projects to shape the process of recovery in the community. Further elaborations pointed towards localization as the process of building strategic partnerships, sharing resources and capacities, and promoting an environment that enables local leadership in quality humanitarian interactions. With locally led response as an outcome, respondents defined it as local actors being empowered to drive relevant and timely humanitarian interactions towards people-centered development. From these definitions, the issue of power of locals to lead were highlighted. When asked what were the perceived impediments to localization and locally led response, the top answers were low capacity and non-neutrality of local actors, the shrinking humanitarian funds, and the resistance of international actors to the shifting balance of power implied by localization. Let's use these impediments to discuss the findings of the study. The most frequently mentioned impediment to localization amongst international actors was the low capacity and non-neutrality of local actors. But historically, networks of regional disaster response networks have been in existence even before the 1919 North Luzon earthquake and the 1991 Mount Pinatubo eruption. Local actors were leading humanitarian responses, with partner international NGOs raising funds to support them. Humanitarian policy reforms have been lobbied by a network of local, national, and international NGOs. Of course, they were led by local actors. But at the turn of the century, international NGOs started more prominent direct implementation. when Super Typhoon Yolanda struck, large humanitarian funds started pouring in, with international actors leading the response, supposedly because local capacities were limited. Even with the continuous capacity building, it was surprising that this argument remained the top impediment to localization for international actors. Local and national respondents claimed to have received humanitarian capacity building on various topics. There were basic topics such as humanitarian principles and standards, rapid damage and needs assessments, protection and do no harm, coordination systems, and technical humanitarian topics and approaches. While many national organizations got trainings from international partners, most local organizations access humanitarian capacity development opportunities from their networks and partnerships with other national actors. Non-compliance to humanitarian principles and standards were often cited as the rationale behind the perception of low capacity. The study showed a high level of awareness on humanitarian standards, particularly the core humanitarian standards and the sphere standards. There was a high affinity to the core humanitarian standards, especially since it idealizes humanitarian actions that are aligned to the work of local development actors. The CHS has also been a guide for local actors to install system-wide changes in their organization. But in the case of the sphere standards, adherence was a challenge because of the lack of resources. While the sphere standards was only meant as a guide, there was perception that they were compelled to meet the recommended figures and to significantly reduce their beneficiaries. These have only led to conflict that lingered long after the distribution of aid. Moreover, there was resentment amongst local actors that they were being held accountable to the standards, while the local government units as the main duty bearers were not. Neutrality of local actors were often raised as an issue of local actors that limited their access to affected areas in conflict. But several local respondents claimed that their familiarity in the locality allowed them to access communities or even be assigned to enter sensitive areas over international NGOs that had stringent security protocols. But instead of humanitarian expertise, donors and international actors have screened local partners based on their system-wide capacities. Organization development emphasized the integration of a humanitarian mandate, admin and finance systems such as procurement, logistics, human resource development, the drafting of a code of conduct, performance management system, staff development and well-being. It also included prevention of sexual exploitation and abuse, safeguarding, risk management has also been incorporated, which included safety and security trainings and service continuity of the organization in case of disasters. There were other factors that led to the perception of low capacity of local actors. Many local organizations were said to be beholden to local politicians, since many were formed primarily to access resources from local government units. Beyond accessing resources for communities, it will later be discussed that local actors applying rights-based approaches and empowering communities were more strategic to become local humanitarian responders. Some attributed low capacity to low visibility. The study revealed that local development actors had low regard for visibility, especially for those who did community organizing. The community's power for self-reliance was promoted instead of the contribution of the national or the local actor. This made local actors invisible to donors. However, the recent push for localization showed that international actors have been more conscientious in recognizing the humanitarian contribution of local actors. The absence or the silence of local actors in coordinating hubs added to this perception of low capacity. The study revealed that local actors do coordinate the responses with LGU platforms. However, they do not regularly attend the meetings to prioritize actual operations. Many of them mentioned that these meetings were often dominated by international actors. Another impediment to localization cited was the shrinking humanitarian funds available and the strong competition for funds. However, allocation of foreign governments for humanitarian assistance have been increasing in the past 2 decades. Not surprisingly, the trend of increasing direct implementation of international NGOs instead of supporting local partners coincided with this increase in funding. Another issue is the quality of humanitarian funds accessed by local actors. Humanitarian funding cannot simply be for goods and services alone, and yet many community-based organizations may do with this type of funding. Quality of funding pertains to the conditions on the duration of the project, flexibility on budgets, the proposing and reporting requirements, and the immediate access to these funds. It also must include indirect operational and support costs, institutional and community development budgets, and institutional recovery costs. For direct costs, it should include budgets to reach out to remote local communities and organizations, compliance to standards, preparedness and quick response funds, and process-oriented costs. Without these, humanitarian actions become highly restrictive, less inclusive, and short-sighted. The study showed that international actors mostly receive their funds from foreign governments. For international NGOs, other significant fund sources were from their own local supporters, affiliates, and various UN agencies. But for local actors, the primary source of funds were from their partnership with international NGOs. For many, these international organizations were existing partners in their development work. Local donors were also cited as significant sources of funds. The issue of competition of funds was true for international organizations. But for local actors, maintaining their partnerships with international NGOs and hoping that their funding streams was sustained were the main concerns. As such, the real impediment to accessing large humanitarian funds were the ineligibility of local actors and the restrictive conditionalities of humanitarian grants. A key concern in the grant bargain was the numerous intermediary organizations between the first recipient and the affected community. For each organization where the funds pass, a certain percentage of indirect cost is incurred. If the funds pass from the international NGO headquarters to the INGO country program to a national network to a local NGO and finally to a community, almost half of the original funds is left. While the roles of the first recipient and the implementing organizations are clear, the role of the intermediary organizations are less appreciated. The intermediary organizations performed key functions in localization itself. Particularly, these were bridging and expanding the reach, filling competency gaps of local actors, sustaining capacity building of local actors, facilitating empowerment strategies such as community organizing, absorbing project risks in behalf of local actors, and ensuring the quality of work of local actors. If these roles are not assumed by the first recipient or the local organizations, the issues associated with localization will only persist, which leads us to the most frequently mentioned impediment by national and local actors: the resistance of international actors to the implied shift in power. Apparently, this meant less funds, less employment opportunities, and less control over humanitarian projects and partnerships for the international actors. But what needs to be understood by international actors is that even local advocates of localization do not want their international partners to disappear. Shifting power is not necessarily a transfer of power and resources from international to local actors. Instead, respondents were stressing the shift from the dominant form of power over to power with. The strategic partnership enjoyed decades before were recognized as the ideal humanitarian solidarity amongst international, national, and local change agents. Most humanitarian actions by local actors were born out of their existing development partnerships. This meant pivoted development funds instead of large humanitarian funds were available. While lower in scale, resources and visibility, These responses were considered relevant, timely, flexible, and aligned to existing community development efforts. Asked what donors and international actors looked for, the primary partnership criteria were those organizations that already have an existing partnerships with them, an affiliation to a network they support, or a track record with the donor. Capacity to access specific affected communities was a second criteria. Capacity to conduct humanitarian actions and comply with humanitarian standards was only the third criteria. While some local actors assumed certification to humanitarian standards will increase access to funds, international actors denied that this was the case. Many local organizations expressed that they were able to do joint, if not lead the decision-making in project planning, implementation, and evaluation, if they worked with international NGOs using a partnership-based approach, as opposed to those who directly implemented or simply subcontracted them. More local actors were able to lead responses when national organizations and networks were deliberate in their own localization process. This meant national organizations were transferring or endorsing projects, organizing and building capacities of local actors, and filling the local actors' competency gaps. But aside from power with, there's also power to empower. There was recognition of the value of empowering more local actors and affected communities. The global demand for greater community participation has often been misinterpreted as community consultations. The study showed that all respondents conducted consultations during disaster response. The real demand was for more social accountability. But social accountability premises on empowered local communities and their organizations. While focus have been placed on the presence of formal mechanisms and tools, such as consultations, complaints response mechanisms, visibility, there was agreement that social accountability can only be sustained with strong community voice and participation. There were much complaints of patronage politics, red tagging, or centralization of responses that suppressed both the accountability of duty bearers and the voice of communities. This meant a conscientious effort to make affected communities be aware of their rights, to capacitate the community to claim these rights, and to ensure that local participatory governance platforms were functional even during emergencies. Consultation should not be limited to asking communities on what they need, but also on what rights they need to fully recover. Moreover, consultations were not the only way to listen to the community. Sustained community presence by community organizers and community-based organizations was critical to hear the real concerns of the community and to gain the trust. The participation revolution will be transformative if communities actively engage duty bearers in critical decision-making processes. There was limited space for community organizing, advocacy, and rights awareness in humanitarian projects. If at all, these were pointed towards the responders instead of the primary duty bearers. These empowerment strategies continued to be conducted, but done outside the scope of the projects. An interviewed donor of a leading advocate for humanitarian policies was not even aware that their partner did advocacy work. Community organizing and continued engagement in participatory local governance platforms were cited as critical strategies to enable social accountability and to facilitate the humanitarian development nexus. Beyond disaster response management, areas of participation and advocacy included themes such as disaster risk reduction and climate change adaptation, sustainable development, and the partnership between donors and responders. Now let's look at some of the localization initiatives undertaken recently. Local actors have mobilized resources amongst local stakeholders in affected communities, from counterpart resources from affected populations to strategic partnerships with local private sectors, to influencing local public funds. The impact of these local solidarity work goes beyond the disaster. Local actors have access resources from networks they belong to, from commitments of national donors to networks, to reserve sustainability and quick response funds of networks, to shared pool funds of different networks such as SAFER. These mobilized resources are directly transferred to local actors. Local consortia with partner international NGOs have also been established, enabling local actors to access larger funding. Larger resources are accessed through partnership with international NGOs. As earlier mentioned, international NGOs have been more deliberate in partnering with national organizations and networks that further localize the response to more local organizations. Moreover, having strategic partnerships with international NGOs have led to policy and practice reforms that have resulted to more inclusive and better quality funding. International NGOs, national organizations, and networks have been instrumental in providing humanitarian training. Strategic partners have been conscientious in providing organization development, support to local organizations in creating adaptive organizational systems, and installing internal risk and safeguarding mechanisms. For international NGOs, a controversial localization initiative is the National Registration of Country Programs, or what they call Southern Affiliation. These have allowed more national voices to participate in their internal processes and projects of international NGOs. However, local actors have criticized that such strategies to simply be dodging the spirit of the global trend of localization, especially for those who have conducted direct implementation. There were also initiatives that enhanced community voice and connectedness of the humanitarian development nexus and different responders. Most of these initiatives have their foundations in the development work of local actors. Response teams amongst POs and NGOs are being formed in various regions through different development networks. POs have become community-based responders themselves, which became quite prominent during the lockdowns. SCLR, or Survivor and Community-Led Response, rapidly organize communities in the middle of a disaster. Existing national networks among CSOs and faith-based organizations have been converging at the national level for humanitarian collaboration, advocacy, capacity building, and fundraising. These included PEPPER, DRRNet, FBO Philippines, and Balik Lokal. More regional and local convergence hubs across different networks have also been observed lately. Several localization pilot projects, ironically initiated by international NGOs, have been implemented in the country that raised awareness and facilitated local initiatives. The challenge is to maintain these pilots to prevent localization from being relegated to mere projects of international actors. Several local and national organizations have engaged the Grand Bargain work streams. They have also endorsed the Charter for Change and actively participated in international South-South networks that promote localization, such as NEAR, ICVA, and A4EP. While these practices and initiatives may not be the norm, it has shown us the possible impact of localization and locally led humanitarian response. Restructure humanitarian funding around strategic partnerships instead of disaster-based projects. Enabling joint decision-making enhances power relationships. Further, it sets the stage for reforming policies for inclusive and better quality funding based on the needs of the local partner. Most importantly, fund localizing intermediary actors who build capacities and enable leadership of more local actors. These have proven to reach more local actors to lead relevant responses. It has benefited local actors who were purposive in their inclusion and gender-responsive interventions. It has also given them a lifeline to sustain their social development work. Joint decision-making has reduced uncertainties, leading to more timely and decisive responses. Build on local leadership capacities. Promote local strengths of local actors so that they can fill gaps or supplement the response of local government units. Support organization development of local actors so that they can be adaptive to different humanitarian and development contexts. Invest on networks and partnerships that are able to share capacities and continuously enrich each one's capabilities. Doing so allows local actors to focus on their areas of competence and effectively collaborate with other responders. Programmatic capacity building were sustained by networks of practitioners. Assert social accountability. Empower communities through community organizing, awareness building on rights, and capacity building on advocacy and rights claiming. Sustain these empowerment initiatives by supporting local actors that capacitate and organize communities and enable participatory local governance platforms during disasters. Doing so results to better downward accountability of duty bearers to affected communities. Reforms introduced during disasters are institutionalized. Coordination and collaboration amongst place-based actors are facilitated. Social capital gained by local actors are leveraged beyond the times of disaster. Development and humanitarian interventions become more connected. Yun lang po. Maraming salamat.